In 1996, the federal investment in prostate cancer research was less than $100 million, and more than 40,000 men were projected to die from the disease. Inspired by the success of the breast cancer movement, a group of philanthropists, physicians, and survivors came together to address this crisis in men's health care. The project to end prostate cancer was named ZERO, and its original mandate was to secure federal resources to find a cure for prostate cancer, in addition to ensuring that patients had access to the best possible treatments for the disease. That goal has since grown to include building a movement of educated and active men, women, and children to create public demand to find a cure. Since its inception, ZERO has increased federal research dollars for prostate cancer by more than 400%. More importantly, advances in the early detection and treatment of the disease have led to a nearly 40% decrease in prostate cancer mortality. ZERO's goal is to create Generation Zero, the first generation of men free of the pain, suffering, and death from prostate cancer. We work to do this in the shortest possible time, because every day without a cure means families and communities across the country must live without fathers, brothers, uncles, partners, husbands, and sons. Our objectives are built on 3 pillars: people, policy, and technology. ZERO works with patients, families, physicians, and researchers to amplify their voices and to secure the raw materials to establish the foundations for a cure. In addition to people, all organizations in the prostate cancer space must collaborate in order for the movement to be successful. ZERO actively collaborates with organizations, institutions, and individuals from government, industry, nonprofits, and the private sector to accelerate efforts to find a cure. People and policy help to shape technology, and technology expands our understanding and pushes us closer to our goal. The characteristics that make ZERO successful are flexibility and agility, high tolerance for risk, innovation, and collaboration. ZERO believes that the key to quickly solving the prostate cancer crisis is to collaborate with others in the prostate cancer space, to seize opportunities wherever they present themselves, and be open to creative and possibly non-traditional alternatives to problem solving. For instance, the Prostate Cancer Research Program within the Department of Defense, an initiative ZERO supports through our advocacy efforts, circumvents the traditional clinical trial procedures by allowing promising compounds to quickly and effectively get to patients without sacrificing safety. Similarly, ZERO's mobile medical program, the Drive Against Prostate Cancer, has produced man-centric healthcare to educate men about the importance of early detection and provide them with free testing in a comfortable, culturally and gender-appropriate forum. In both examples, non-traditional and innovative solutions have had exceptional results, but both examples also carry a high degree of risk with the potential for a high reward. ZERO engages people across the country in 3 main ways: the Great Prostate Cancer Challenge event series, the Drive Against Prostate Cancer mobile cancer testing program, and the Summit to End Prostate Cancer. Additionally, ZERO participates in national awareness partnerships, including the National Hockey League's Hockey Fights Cancer and the On the Line campaign on ESPN. Robust communications and marketing efforts, in-house professional event planners, and full-time government relations staff support each of our activities. Through our many initiatives, ZERO is leading the fight to end prostate cancer by promoting greater awareness of the need for early detection, leveraging public resources for life-saving research and new treatments for those with the disease, and providing life-saving testing to at-risk men. The primary metric for assessing ZERO's success is the realization of Generation Zero, the first generation of men free of pain, suffering, and death from prostate cancer. When this metric is achieved, the organization will happily shut its doors. On a yearly basis, ZERO measures its success by the following indicators: Preservation and growth of federal prostate cancer research resources. Increases in the number of participants and appropriate additions to the event series. The number of participants and events with the Drive Against Prostate Cancer program. The introduction of new treatments for the disease or improvements in existing treatments. And a decrease in the annual national mortality statistics for prostate cancer. Since Zero's formation, we've seen a nearly 40% decline in prostate cancer deaths. Prostate cancer is very similar to breast cancer. Both diseases have roughly the same caseload and are hormone-driven. However, prostate cancer lags far behind breast cancer in public awareness and resources dedicated to finding a cure. For example, federal funding for prostate cancer is less than 50 cents on the dollar compared to breast cancer. Despite being underfunded and undermanned, the prostate cancer cause is growing by engaging men and those who love them. Since its inception in 1996, Zero has increased federal research dollars for prostate cancer by more than 400%. The organization was pivotal in the creation of the premier prostate cancer research program in the country, the Congressionally Directed Medical Research Program. Nearly every new advance in prostate cancer treatment and early detection has been touched by the Congressionally Directed Medical Research Program. During the last decade, the Drive Against Prostate Cancer mobile prostate cancer testing program has provided more than 113,000 men with potentially life-saving education and health care. The Drive's collaboration with researchers led to discoveries in the relationship between cholesterol and prostate-specific antigen and proof of the value of the Pro-PSA as an additional diagnostic indicator for the disease. The Great Prostate Cancer Challenge has grown from 1 to 32 events in 5 years, engaging more than 24,000 people. More than $4 million has been raised in the last 4 years alone. Historically, Zero has faced funding issues as the organization's structure has changed over time. Originally, Zero was to be an association of associations. Due to concerns about competition and independence, the original bylaws severely limited Zero's options for fundraising. Zero has been forced to restructure the organization and the board to a more traditional nonprofit format. We're proud to say that we've moved the organization from a budget of less than $1 million a year to an anticipated income of nearly $4 million. Zero has also risen to become the fastest-growing prostate cancer organization in the country. Our continuing challenge is to grow our donor list to ensure that there are adequate resources to allow us to achieve our mission. With additional resources, Zero would jumpstart its awareness activities with a large national media campaign to push the public's consciousness of prostate cancer and the need for a cure to a tipping point. Additional resources would also be used to hire personnel to develop a greater grassroots structure and to expand the communications to support our marquee activities, the Great Prostate Cancer Challenge, the Drive Against Prostate Cancer, and the Summit to End Prostate Cancer. For several years, Zero has considered the idea of providing direct financial support to prostate cancer patients, especially those that require compassionate use of new drugs or those that don't have the financial capacity for treatment. In many cases, a patient may have medical coverage, but may not be able to afford transportation to the treatment facility, or may be unable to pay for their spouse or family member to accompany them. Many men are willing to participate in clinical trials, but lack the funding to travel to the locations where they're held. The trial sites cannot pay these potential participants for travel for a variety of financial and regulatory reasons, and so important trials go unfilled. If Zero could provide travel and living expenses to some of these potential clinical trial patients, we could help fill trials that may provide patients with new and highly effective medicines.